Hello everyone, welcome to Thea's July Town Hall. I hope that you and your family had a safe, happy, and healthy Independence Day. I took the time to reflect on my life growing up in Texas and the freedoms here in America that I am so thankful for. As I transition to an adult and to a career woman, there is one thing that truly stands out that I am so thankful for, and that is our right to participate in the public process. More specifically, those processes related to our environment and our water and Superfund sites, and how we here in America have the right to participate and to lobby our government when it comes to these items. I've often thought, as a female environmental advocate, how fortunate I am to be doing this important work here in America. Other activists in other countries oftentimes have their lives threatened and sometimes taken simply for advocating for a better and safer environment to live in. And I'm so thankful that here in America, we do have systems in place that protect folks like myself. Many of our systems are not perfect, but we have the chance to be our own advocate, to contact our government when something is going wrong or we suspect something isn't right, and to participate in these processes that oftentimes impact our communities directly. Every project that I'm going to talk about today has a public process in place, and I feel so fortunate that we are able to use our voices and advocate for the change that we know our region so desperately needs. Before we dive into site-specific updates, I wanted to touch on the Texas Cancer Registry and the limitations that we have when advocating for public health. This is something that goes across all of our platforms here at Thea, and it's important that we all understand the restraints and limitations of the system that we work within. So, many of you know that for the Santa Central project, we identify the cancer cluster in East Harris County. And more recently, there has been a cancer cluster identified in Houston's Greater Fifth Ward. And so hearing these words, cancer cluster, we have to think, what does that even mean? And so according to the Center for Disease Control, a cancer cluster is defined as a greater than expected number of cancer cases that occurs within a group of people and a geographic area over a defined period of time. And this is exactly some of the limitations that we have at hand when we're doing our work to try to understand and get a holistic look at a community's health. So first and foremost, we're limited by time. We're limited by the amount of information that the Texas Cancer Registry has through time. For example, the Texas Cancer Registry only has available data for cancer diagnosis in the state of Texas from 1995 to 2016. So when we're looking at communities who have endured contamination for sometimes over 100 years, it's really difficult to get a clear understanding of what their health has been like over time, what it's like today, and what it might look like in the future. So understanding these limitations is important. The next limitation is the geographic area. So the Texas Cancer Registry has data available per census tract, and that data can only be retrieved per cancer type, per census tract. Right? So most folks think, okay, we want to look at a community's health. Let's pull all of the cancer data for that community. It doesn't work that way. The Cancer Registry can only be looked at per area, per cancer type. So that is one of the most important reasons why at Thea we collect health surveys. So I ask all of you to please trust us with your personal information. Fill out one of our health surveys, because that allows us to then relay information to the state of Texas and what they should be looking for in each geographic area. For example, if multiple myeloma were at a high rate in, say, the Greater Fifth Ward, if we weren't retrieving multiple myeloma cancer information for that geographic area, it could be out there in a high rate, but we wouldn't know it because we were not seeking that information specifically. So you have to look at the geographic area per cancer type. And that's why it's critical for us to get as conclusive as an understanding as possible about the types of cancer that people in a specific community have been diagnosed with. So again, this goes across all platforms of our work, and that is public health. And so working with communities and trying to get an understanding of their health and the potential impacts from environmental contamination, it's critical that we understand we are limited by time, we're limited by geographic area, and we're limited by cancer type. So I ask all of you to help us help you as we continue our efforts across the greater Houston area. All right, now I'm going to give some updates related to the San Jacinto River waste pits, most specifically, and then I'm going to move into some updates for the San Jacinto River Coalition that have to do with the general area and that I know community members are very interested in. So right now, we are still waiting for the 30% design packages and treatability study results to be released publicly. The 30% design package for the southern impoundments was handed over to the EPA earlier this summer, and the technical review team had an opportunity to review that report and provide comments back to the EPA. Then the 30% design package for the northern impoundments was given to the technical review team, and that is still currently out for comment. So the folks that make up the technical review team are currently reviewing the 30% design for the northern impoundments. And again, these reports have the treatability results. And so that's part of the great interest that we have here. First and foremost, I'm interested in the construction plans moving forward that we should see in these design packages. We know that the pre-design investigation found that the contamination at the waste pits is in fact deeper and in greater concentrations than we have ever understood. So I do expect for what we see in the design packages to be a little bit different than the conceptual understanding of remediation that we've had to date. So I am extremely interested to see where the EPA believes this is headed, but I am also incredibly interested to see the results of the treatability study. Now, why that really matters is because in that is how the responsible parties consultants believe we are going to classify the waste. And I say believe because this has been a back and forth for about 2 years now, when it first came to our attention that the responsible parties and the EPA were saying that it looked like this waste would be classified as Class 1 non-hazardous industrial waste. For all of our residents who live around the San Jacinto River, we're calling on you to please visit our website and fill out a health survey. Several years ago, we worked with Texas Department of State Health Services to investigate cancer rates around the river, and they found multiple types of cancer in statistically significant rates. For children, they found brain cancer, leukemia, glioma, melanoma, and retinoblastoma at abnormally high rates. Then for people of all ages, they found brain cancer, female breast cancer, male breast, cervix, kidney, leukemia, liver, lymphoma, and myeloma. So now that we're going to be taking another look at the community's health, we need you to help us help you. Like I mentioned earlier, we cannot go into the Texas Cancer Registry and pull all types of cancer for a specific area. So if you've previously filled out one of our health surveys and had a change in your cancer diagnosis or the status of your health, we ask that you please fill out another form so that we have the most up-to-date information for your health so we can be the best. All right, shifting gears now for San Jacinto. Many of you who are with the San Jacinto River Coalition are very familiar with the AstroTurf group that popped up many years ago in opposition of our advocacy efforts for full remediation of the waste pits. This group went by the name of Keep It Cat. They also went by a name called SJ Cap. And then we also had a group that popped up a little bit after those two that went by the name Galveston Maritime Business Association. And we struggled to find any real community members who aligned with their position, and that was that they felt it was actually a good idea to leave the waste in the river. So after attempts on our end, community members' ends, to actually find anything out about who was really behind this group, we came up with nothing until the attorneys for waste management filed a notice of correction in the courts with the waste pits litigation. And it was like Christmas. You know, we'd been trying to figure out who was behind this group, and then it was in black and white. It's not even something that we had to discover. It was filed. It was incredible. And it says here that they were informing the court and the parties in this case that the defendants have been involved in some community engagement efforts relating to the ongoing remediation of the San Jacinto River Waste Pit Superfund site. The activities include significant participation by retained third parties and involvement in keepitcap.org, the San Jacinto Citizens Against Pollution, or SJCAP, and the Galveston Maritime Business Association. Golden. So finally, it's been brought to my attention that Keep It Cap's website has come down. You know, they had this really professional looking website that was edited and updated regularly, and it has come down. So we haven't heard anything from these groups since this motion was filed in court. So if you guys hear anything, let me know. I'm very curious about it. But as of right now, it seems like they have just totally gone dark. Okay, other updates for the areas. Many of you have heard in the news that there was an oil spill in Crosby, and I have gotten a lot of mixed reviews from the general public about what their understanding is of the issue. And so I spoke with some of our officials within Harris County, and what I need you to know is that this is an ongoing oil spill. Oil is leaking from an unknown source. It's been suspected in the media to come from a nearby an auto shop, but there's no confirmation that that's exactly the origin. It's also been reported that there are drums of oil that were buried and found. Harris County officials tell me there are no drums. This is simply loose oil in the ground, and it's been seeping into the local waterways, which ultimately led to the discovery. So it's an ongoing investigation. They're working to find the source of this oil, but at this time, it is unknown. So, keep me posted what you guys are hearing out in the community. I always, I'm curious what y'all are hearing. The local knowledge is everything, as y'all know. So keep me posted, but that's the latest that I have from our officials. Okay, and my last San Jac related update is for the Interstate 10 bridge replacement. So I've spoken with my contact at TxDOT, and they've let me know that they're still in the very early and preliminary stages of planning the bridge replacement. But as of right now, it looks like they will begin construction mid-2025. Now, there's a lot that can go on between now and mid-2025, but at where they are right now in these preliminary planning stages, it does look like that's the time window when the bridge replacement would be taking place. Now, if all goes well and on target with the waste pits cleanup, that could work out perfect. Get the waste pits out of there and then replace Interstate 10. So anyways, I will keep y'all posted with what I'm finding out related to all things San Jac. Okay, now jumping over to the opposite end of Harris County, to Northwest Harris County in Cypress, where we have the Jones Road Groundwater Plume Superfund site. This Superfund site is the result of about 14 years of a dry cleaning company dumping their solvents out back on or down the stormwater drain. And unfortunately, it has created a complex plume of contamination in the groundwater system. And these contaminants can not only seep deeper into our groundwater aquifers, but they also have the affinity to vaporize. So they can actually rise up through our subsurface, even through cement slabs of homes and or businesses, and vaporize into the air. So we have a few potential concerns here with exposure pathways. I let y'all know last month that we'd received a PowerPoint from the EPA, which was a presentation that they would have given if they would have been allowed to travel to the community this summer to have a public gathering. Obviously, due to the pandemic, that couldn't take place, and they sent us the presentation. However, I've not felt comfortable presenting it to the public or our followers in the Cypress area because we simply don't have all of the information. To date, we've really just received bits and pieces of the greater picture. And so we submitted a Freedom of Information Act request to the agency asking for some of this data that, we're only seeing part of. And so we're looking to get complete data sets and a complete picture of what the contamination looks like and what the potential risks are for the environment and public health. So I did receive some clarification between last month's town hall and today. I received clarification on the indoor air monitoring and sampling that's taken place in the shopping center above the Superfund site. So the dry cleaner that created the Superfund site was in the farthest northwest corner of the shopping center. And so we've known that units within the building and the next two units have had unsafe levels of vapors, of toxic vapors in their air. In response to this, the EPA put in soil vapor extraction units in these first three units. However, all of the data that I've been through, I can't find indoor air quality data for the rest of the shopping center. Talking with folks who go to the shopping center, who even have worked in the shopping center, have felt, that they smell things that are abnormal. They feel headaches and other health symptoms when they're there at the shopping center. And so we wanted to know, what has been done to look at the air quality inside of the shopping center and if it's in fact safe or not. So I finally received clarification from the agency, and in fact, they have not sampled every unit in the shopping center. They sampled 3. They sampled the one that was the dry cleaner and the adjacent 2 units. They found unsafe levels of toxic vapors in the air, and they stopped. They stopped their sampling. So we need all of you to go to our website and sign the letter that we have asking the EPA to sample the rest of the shopping center units. We know these harmful contaminants are underground there. We know they have the ability to vaporize. We know they have the ability to permit through a cement slab. And once they become indoors, it's very dangerous. It can be a very dangerous situation. And they can remain indoors for a period of time. So this is absolutely something that needs to take place, and it needs to take place quickly. I am saddened that it hasn't taken place already. Disturbed that unsafe levels of air vapors were found, and that for whatever reason they didn't continue sampling. To my knowledge, that's not standard sampling protocol when you find a problem. So we need to make sure that this site, even though it is what they consider an orphan Superfund site, it does not have a responsible party that's paying for the cleanup. We need to make sure that our federal government is doing the due diligence. And so we need all of you to use your voices, sign our letter on our website, and please know that we are going to send it to the agency advocating for the health and safety of this area. All right, now let's talk about what we know and what we don't know about the groundwater in this area. In the first 2 months of this year, the EPA sampled groundwater from monitoring wells that are within the immediate area of the shopping center. And so some of these wells are on that north portion of the property, northwest portion of the property, and then to the west around Jones Road, and then one even getting a little bit closer to the Ace Hardware there. And so we only have data for PCE, or tetrachloroethene, which is one of the primary contaminants of concern for the Superfund site. But again, that's the only contaminant I can report to you on. We're still missing data for a whole host of other contaminants. When I asked the agency recently for this data set in totality, they told me that I would be receiving it with my Freedom of Information Act request. So maybe next month I'll be able to give you more data. But what we have right now for PCE, in the depth below ground surface from 60 to 225 feet, all of the monitoring wells had unacceptable levels of PCE, all of them. So these are what we say is unacceptable, is a level above the MCL, or max contaminant limit. This is the enforceable level at which we know anything above that is not allowed by federal law to be in drinking water. Those monitoring wells are not used for drinking water though, but it is absolutely a clear picture into the health of the groundwater within the area that undoubtedly is used for drinking. So now talking about what we know about the residential wells. Earlier this year, also the EPA sampled residential wells, groundwater wells. I'm appreciative of their efforts, and they have actually even more recently agreed to sample more wells. But one, I need to see the complete data sets. And then what we did see was out of the wells that they sampled within the known contaminated area, they found 6 privately owned groundwater wells supplying residential properties to be above the MCL. So 6 of these wells tested with unsafe levels of PCE. And so these wells ranged from a depth of 114 feet below ground surface to 240 feet below ground surface. So if you live near this area, if you have friends, family, or colleagues that live near this area, please ask them to contact us. The EPA had agreed to conduct another round of residential groundwater sampling this June. And I followed up with the EPA recently about this and was wondering how the event went, and basically got the response that it didn't take place because they did not receive any interest. 51% of the community that we know the plume has migrated under is supplied by private groundwater wells. I cannot imagine that the people who own those homes would not want to know if their water was safe or not. These are things that we cannot readily see or smell or taste. And I strongly encourage anyone who has a private groundwater well within this area to allow the agency to test their well, to reach out to us or directly to the EPA and ask that their groundwater well be tested so that we can see if they have these harmful contaminants in their well or not. All right, now let's move this conversation a little bit closer to the heart of our great city, going to the greater 5th Ward. Many of you have probably heard about the contamination from Union Pacific in 5th Ward. And this facility began operating in the early 1900s. So we're truly talking about historical contamination here. But like many of our communities in the greater Houston area, the environmental contamination is complex. And so we know that nearby there are 2 Superfund sites, the North Cavalcade Superfund site and the South Cavalcade Superfund site, which are both, again, creosote and creosote-related contamination. Then there's many brownfields in the community. We have abandoned gas stations, abandoned dry cleaners that have the potential to be contaminating the environment. But nothing comes close to the stories I've heard from community members about growing up swimming in the Union Pacific creosote ponds. Community members seeing the runoff from a rain event with a rainbow sheen across it. And then many of these community members were children. They didn't know any better than to swim in this pond that they thought was great, a place to cool off, not a toxic creosote pit. Or being a child and seeing water with a rainbow sheen and thinking that's something special, when come to find out years later that this is in fact contamination that's plagued their community. So I look forward to being able to further this conversation. And before we get to the live Zoom tomorrow, I want to discuss with you in this town hall some of the things that we know about the community and the community's health. Of the 9 types of cancer looked at in these studies, the following cancers were found statistically significantly high rates. We have acute myeloid leukemia, esophagus, larynx, liver, lung, and bronchus. Now, this is only for people 20 years of age and older, diagnosed with cancer between the years of 2000 and 2016. What we don't know is what's out there beyond these types of cancer, beyond that time window from 2000 to 2016. And we have no idea what childhood cancer looks like in this community because the state simply hasn't pulled childhood cancer rates. So we submitted a letter to Texas Department of State Health Services asking very specific questions. And one was why they only looked at the window of 2000 to 2016 and not the entire available window of cancer data, which would be 1995 to 2016, as well as why they selected the geographic area they did. In their last published study, they looked at 21 different census tracts. And so some of those get you closer to the Houston Ship Channel, which if we're looking for a localized issue, I'm not so sure we should be looking near the Houston Ship Channel. And then we also asked if they would be willing to look at additional cancer types as well as childhood cancer. And lastly, we asked if they were going to be hosting a panel of experts for a one-time conversation or a continuing conversation and dialogue about the potential for a full epidemiological study. Now, when the state finds cancer rates and statistically significantly high rates, they're required to set up this panel. And so I was wondering, is this a continued dialogue or is this a one-time event? And this is the only item out of the multiple points we asked about in our letter that we received feedback on. And that was that they are in fact looking to set up a discussion with a panel of experts once. Not a continuing dialogue, but a one-time discussion about if a full epidemiological study would be feasible. So like with all of our communities, we need your help. We need you to help us help you. We need you to visit the link below at our website and fill out the community health survey. Send us messages, send us notes about either your own diagnoses you know of in the community, so that when we work with the state to get a more conclusive look at the community's health, it can be as conclusive as possible because we will have heard from you, and that's what we need. We need you to help us help you. In closing, I want to remind everyone that we are here advocating on behalf of public health and your environment, even during these pandemic times. Like always, we need you to use your voice to communicate to us what your needs are, what your concerns are, so that we can elevate those to the appropriate agencies. Please visit our website to fill out the Jones Road letter and the call to action for indoor air sampling that is so critical for that Superfund site. And then across the board, no matter what community you come from that we work with, please fill out a health form so that we can be the best advocate for public health that we can be. I hope that you stay safe. I hope that you are well, and I look forward to next month's town hall.